Knee injuries are relatively common among basketball players due to the nature of the sport, the movements involved, and the stress placed on the knee joints. Here are some reasons why knee injuries occur frequently in basketball. Number 1. High-intensity movements. Basketball is a dynamic sport that involves quick accelerations, decelerations, sudden changes of direction, jumps, and landings. These explosive movements put significant stress on the knees, making them vulnerable to injuries. Number 2. Jumping and landing mechanics. Basketball players frequently jump to shoot, rebound, or block shots. The landing mechanics during these jumps are crucial. Poor landing technique, such as landing with the knees locked or in an awkward position, can lead to excessive strain on the knee joints and ligaments, increasing the risk of injuries. Number 3. Contact and collisions. Basketball is a contact sport, and players often collide with each other during games. Direct contact, especially when players collide into the knee area, can result in ligament sprains, such as anterior cruciate ligament, ACL, tears or strains. Number 4. Overuse and repetitive stress. The demands of basketball training and frequent games can lead to overuse injuries. Constant running, cutting, and jumping without sufficient rest and recovery can cause stress on the knee joints and surrounding structures, such as tendons and ligaments, leading to conditions like patellar tendonitis or jumper's knee. Number 5. Weakness or imbalances. Muscle imbalances or weakness in the lower body, particularly in the quadriceps, hamstrings, and gluteal muscles. It can affect the stability and alignment of the knee joint. Insufficient strength in these areas can increase the likelihood of knee injuries. Number 6. Inadequate conditioning and training. Insufficient conditioning and inadequate training techniques can contribute to knee injuries in basketball players. To minimize the risk of knee injuries in basketball, players can take several preventive measures. Engage in proper warm-up routines that include dynamic stretches and exercises specific to basketball movements. Focus on strengthening the lower body muscles, especially the quadriceps, hamstrings, and glutes, to provide better support and stability to the knee joints. Work on improving jumping and landing mechanics to reduce excessive stress on the knees. Use proper footwear with adequate ankle and arch support to enhance stability during movements. Incorporate rest and recovery periods into training schedules to allow the body to repair and rejuvenate. By understanding the factors contributing to knee injuries in basketball and implementing preventive strategies, players can reduce the occurrence of such injuries and enjoy a safer and more sustainable basketball experience.